Thank you very much for inviting me into your home, at least virtually. Um, what you are doing is so important. You know, rural healthcare sometimes gets overlooked in our world, and I think one thing COVID has done is hopefully going to bring down some of the barriers. It's going to bring down barriers between long-term care and acute care. And that was part of the problem at first. That's why, nursing homes were hit so badly, partly because there's a wall between long-term and acute care. I think it's going to bring down walls between the hospital, acute care, and public health. And I hope it's going to bring down some of the walls that have existed between big city care and rural care. And we've worked with a lot of rural hospitals. I'll give you a spoiler alert executive summary. Toward the end of the presentation, I'm going to share with you the comments from 93 of your colleagues, their perception of your organizational culture. Spoiler alert, it's really pretty good, but it's not great. And you do have work to do. So I want to start by sharing our guiding insights at Values Coach. Again, we've been doing this for a long time. We've worked with a lot of hospitals ranging from critical access to major academic medical center. And there are three things that guide our work. And number one, culture. We talk about changing culture or improving or enhancing culture. Culture really does not change unless and until people change, because the culture of your organization is shaped by the collective attitudes and behaviors of the people who work there. And if nobody's willing to change, if people say, yeah, we need to improve our culture, we need to have a better workplace here, but I'm not the problem, it's everybody else. If nobody's willing to look in the mirror and say, I really could improve my attitude. I could be more aware of my impact on other people and my relationships. Nobody's willing to do that hard introspection and say, yeah, I'm going to make a commitment to do a better job myself. You can bring in motivational speakers, give everybody a book, give everybody the little happy face pin. And a month later, it was a program of the month, nothing changed. The happy face pin is on upside down. The book is on a bookshelf somewhere unread. But the second guiding insight is this: people will not change unless you give them a new approach. Change is hard. We've all tried to change and failed. The New Year's resolution shows up dead on arrival. This is the year I'm going to get out of debt, lose weight, get in shape, whatever. And a year goes by and we haven't done it. And it's, the one definition of insanity is doing the same thing over and over and expecting a different outcome. And if what you're doing now isn't working, and for many of us, what we're doing now is not working, try something new. And that's one of the things I'm going to challenge you with, is including with the all staff presentations that come up later. I'm going to challenge you to think about your own life, your own goals, your own outcomes, personally, professionally, in a new way. And that's the third guiding insight. The best way to help somebody be a better employee is to help them be a better person. You help somebody be a better parent, they will automatically become a better caregiver. There's something that, I don't have a slide on this, but it's something that's been on my mind a lot lately. And it's I've come to see this as the ultimate paradox in life. And that is this: whatever you most need at any time in your life will be hardest for you to find at precisely the time you need it the most. It's easy to be motivated when everything's going great. It's also irrelevant. Everything's going great. It's when the roof is falling in on you, the job's not working, the kids are in trouble, your health is failing. That's when it's most important for you to be motivated. And that is also when it's hardest, because what you want to do is crawl under the bed and pull the door in after you. And the time to work on having the courage that you need, the determination and perseverance, the resilience you need, the time to work on those things is yesterday would have been good, but today. And here's why I think that paradox is so important now. We may feel like this, I've been in healthcare for more than 40 years. There has not been a year that I haven't heard somebody use the term healthcare crisis. This is the first time I've ever felt that it is truly warranted. That this really, the challenges people are facing, the personal grief, the emotional trauma, the in some cases the loss of hope people have. You know, we had 2, then 3 surges. Now we got surge number 4, and a lot of people are just saying, I can't do this anymore. And I think it would be really unfortunate for us to assume, well, this is the last surge. This is the worst it's going to get. We need to help people prepare for whatever's going to come next, even if we don't know what it is. I got a letter from Paul Udemark. He tragically passed away early. He was the CEO of a critical access hospital in Nebraska, Fillmore County. And he said, I got a whole new team and didn't have to change the people because they changed themselves. And I've come to see that as the gold standard of culture change. When enough people make that personal commitment, I'm going to change my attitude. I'm going to change my behaviors. I'm going to be part of this more positive culture that we aspire to having here. When enough people make that commitment, the change becomes sustainable and permanent. And in fact, after Paul passed away, a new CEO came in, and he wrote an article in the employee newsletter about a year later. And he said, I came in thinking that I knew all about culture and I was going to change the culture. And what happened is the culture changed me. And he talked about the self-empowerment pledge and the pickle challenge and the 12 core action values that they had made part of their culture. When your culture transcends any one individual or any one job title, then you know that it's become something permanent and sustainable. And you know, I imagine you may have seen some variation of this meme on the internet, and I love this image. Tabby Cat looks in the mirror and there's a lion looking back, and it raises a really good question. Who could you be? What goals would you achieve if you didn't let fear stop you from doing what you have to do to be that person? For many of us, though, the picture's reversed. We are the lion. You know, when we were little kids, we had big goals. We thought we could do anything, and then life happens. You know, parents tell us no, we go to work and we have bosses and bullies, and pretty soon it's another day, another dollar. And we start to pretend to be less than we really are. And the challenge is, how do you remember, go back and look in the mirror and say, you know, that's who I am meant to be. That's who I want to be. Those are the goals I want to achieve. But it's not enough to just see that picture. You have to be willing to do the work, don't you? And sometimes it's hard work, physical work, emotional, intellectual work. But when enough of us make that commitment together, which is what culture change is really all about, that we're going to all collectively do better, then you start to look in the mirror and say, you know, I really am capable of more than I've been giving myself credit for being. So let me remind you why we do what we do. My mom is now almost 93 years old. She lives in San Antonio, Texas. A couple of years ago, I got a call from Northeast Methodist Hospital in San Antonio. Your mom has been admitted. So of course, I was on the road somewhere. I change all my travel plans, fly down to San Antonio fast as I can. I get to the hospital, go up to the nurse's station. I say, I'm looking for Joe Tye, my mom. And the unit clerk smiles and says, oh, yes, Ms. Tye. And she'd been here for all day asking for a hot dog. I said, no, my mom's sick. She's 90 years old. Oh, yeah, that's the one. I go into my mom's room and there she is. Isn't she cute? I didn't always think that. And I say, how you doing, Mom? And she says, well, I'm doing okay. They're taking good care of me. And I look at that tray of food. I say, hey, Mom, for hospital food, that looks pretty good. What's the matter? Aren't you hungry? She said, well, I really am. But all I want is a hot dog. I just have a craving, and they don't have hot dogs here at the hospital. A couple hours later, my mom's nurse, Arturo Rodriguez, comes in her room and brings her a hot dog. Now, look at the look on my mom's face. That is what genuine patient satisfaction looks like. You can't measure that with HCAHPS. But that is what a truly happy patient looks like. Look at the look on Art's face. That is what employee engagement at the best level looks like. And I will point out to you, it is not in Art's job description to drive to a diner and buy a hot dog for a little old lady who's got a craving. He could not be held accountable for that in his performance appraisal. It's not in his job description. In fact, had he not done it, nobody ever would have known. The reason he did it was not because he learned it in nursing school or because he was being held accountable. The reason he did it is he saw his role at the hospital as being more than just starting IVs and changing bandages and doing temperature checks. He saw his role as doing whatever his patient needed to have a good experience. And it's the difference between accountability and ownership. Accountability is externally imposed motivation. It is doing what you have to do because of the carrot and the stick, reward and punishment. And usually we think of it in terms of punishment, not reward. Ownership is doing what needs to be done, whether or not it's in your job description. It comes from the intrinsic motivation of personal pride and commitment and determination to do the best you can. And when you have a culture of ownership, everybody has the same job description. First and foremost, a caregiver. I don't care what your job title is. I was at Loma Linda University Medical Center in Murrieta, California, earlier this year. I met an environmental services worker, a housekeeper. You know what he does? He goes in, every patient room he goes into, he asks them if they would like him to sing. And he sings for them. And I guarantee you that many of those patients, a year or 2 or 3 years later, they're not going to remember the name of their doctor or their nurse, but they will remember David, the housekeeper, who sang for them in their room when they were feeling bad. That is being a caregiver. Last but not least, a janitor. I was making rounds with the chief nursing officer at that same hospital, and she stooped down to pick up a rubber glove that was on the floor. She didn't see that as beneath her to be a housekeeper. And then in between, whatever else needs to be done. And never saying those awful 3 words, not my job. Mm-hmm. In a culture of ownership, people replace not my job with how can I help? And asking for help when they need to. You know, we don't have enough words in the English language. I love hot dogs. I love hiking in the Grand Canyon. I love my wife. The word love means something very different in those 3 sentences. And if we're going to use the word accountability, which we do a lot in healthcare, we need to be clear about what we're talking about, because accountability really occurs at 3 levels. We mean 3 different things. Think of it as the accountability hierarchy or continuum. Most of us, if we say, I'm going to hold you accountable, or nobody ever holds anyone accountable. You know, it's interesting. I've never, ever heard anybody say, the problem with this place is nobody holds me accountable. It's always somebody else. Hierarchical accountability, that's the accountability of a boss over a subordinate, parent over child. It's the accountability of the carrot and the stick, reward and punishment. Think of the metaphors that we use. I'm going to hold your feet to the fire. I'm going to crack the whip. I mean, those are forms of torture used in the Middle Ages that we now use as a metaphor for holding somebody accountable. No wonder if you say to somebody, I'm going to hold you accountable, they back up 2 steps. And no wonder nobody ever goes home and says, hey, I had a great day today. The boss held me accountable. It's always perceived as something negative. And the truth is, when it comes to the things that really matter, especially in healthcare, you cannot hold people accountable. How do you hold somebody accountable for pride? How do you hold somebody's feet to the fire to make them more compassionate or empathetic? How do you crack the whip to make somebody improve their loyalty to the organization? In fact, it's like squeezing Jell-O. The more you hold somebody accountable, the more likely it is they're going to jump ship when something better comes along. A much higher, more powerful level of accountability is cultural accountability. That is us holding each other accountable. This is why nobody smokes in public places anymore. I bet you anything, you don't have any no smoking signs in your hospital except maybe at the front door. You don't need them anymore Because if somebody lights a cigarette anywhere at Marshall Browning Hospital, somebody else is going to say, put that out or put it out for them. And think about this. If somebody is talking about a colleague behind their back, passing rumors, and one of their coworkers says, you know, we don't do that here at Marshall Browning because we care about integrity. We care about dignity and respect. That is far more impactful on somebody's behavior than being called into the boss's office and say, so you've been talking about someone behind their back. Cultural accountability is always more powerful than hierarchical. And the highest level is personal accountability. I don't talk about people behind their backs because I care about my integrity. I care about their reputation. And here's the thing. When people are willing to do that, when they're willing to walk across hot coals on their own, you don't have to hold their feet to the fire. And you hear a whole lot less about accountability when you have a culture of ownership. And the three words that to me capture what a culture of ownership really is: proceed until apprehended. If something needs to be done, do it. Don't just complain about it. If you need help to get it done, ask for the help. And where we've seen this proceed until apprehended mindset become a part of the culture, we see improved patient satisfaction, improved productivity, everything else. But it's not that we're trying to improve those things. Those are, that's a trailing indicator of the personal change that fosters the cultural change. Let me invite you to go with me on a river trip. Imagine that we're on this river trip with our guide from Outward Bound. It's a beautiful day. We stop on a white sandy beach for lunch. And our guide comes around, are you having fun? He says, oh yeah, this is great. He says, well, don't get too complacent because the big adventure hadn't happened yet. We get back out on the water and it's going faster and rougher. And suddenly we drop down into this hurricane of white water. And our guide there in the back of the boat hollers out, hang on, folks, this is it. The class 5 rapids I've warned you about all week long. Everybody grab a paddle, dig in, and paddle for your life. And this guy in the back there says, I don't paddle. That's not my job. What do? And I know if we were all together in the same room, somebody would holler out, throw him out of the boat. And that's exactly right. When you're in class 5 rapids, I don't care what your name tag says. You do what needs to be done. We are today in the metaphorical equivalent of class 5 rapids in healthcare. I know in your organization and many other places that we are seeing people do things that are not in their job descriptions. I was on a call earlier today with somebody who's a marketing genius who works with healthcare organizations. And she was telling me about a chief nursing officer at a big hospital. They couldn't find transport people. I mean, the staffing crisis is not just nurses, it's kind of across the board. This CNO is spending 1 day a week transporting patients. Not beneath her dignity to get out there and move a patient. What else is that doing? It's having a positive impact on morale because that CNO is out there. She's being visible. In the book, The Lord of the Rings, Tolkien has Gandalf the Wizard show up where he's most needed but least expected. And I think that's what leaders do. That's what she is doing. She picks up the paddle and paddles. Let's do another river trip. Imagine you are the captain of this beautiful galley ship, and it's your job to get it across the water on time, on budget, with your cargo intact. And you've got 100 people at the oars. And of those 100 people, 25 of them really believe in the mission. They're putting their backs into the work. 60 of them, it's just a job. They're not doing a bad job necessarily, but don't ask them to paddle any harder. And 15 of them are actually rowing backwards and getting in the way of the hard workers, calling them nasty names like overachiever, quota buster, brown noser. How many ways do we have to tell someone to sit down, shut up, and stop trying to try so hard? Would you be proud to be captain of a ship like that? And I hope your answer is no. How would you feel if you were one of the 25%ers really working hard? How would you feel about everybody else? Would you want them to raise their expectations? And unfortunately, That is a picture of the average American organization today. Gallup, Press Ganey, my company, every survey shows that about 25% of people pre-COVID are highly engaged in their work. 60% are not engaged. That doesn't mean they're doing a bad job, but it's just a job. And 15% in the average organization are aggressively disengaged. Now, there's obviously a huge range, but that's the average. Those highly engaged people, those are the spark plugs. They come into a room with a smile on their face. You run into a problem and they're rolling up their sleeves, helping with it. And then you have the zombies. Another day, another dollar. Is it quitting time yet? Is it Friday yet? Can I retire yet? And then you have the emotional vampires, the people who just suck the life out of an organization, suck the energy out of everybody around them, suck the joy out of the work. And back to the paradox, their impact is the most pernicious at times when everything's the worst. When you need them to help the people around them raise their spirits and find joy where it's hard to find. Let me show you how important this is. I'm going to share with you results from one question that 2 hospitals, both big medical centers in the same urban area, did on their call. These are questions your colleagues have answered. The question is, our culture does not tolerate bullying, toxic negativity, or disrespectful behavior on a 5-point scale. Hospital 1, 8 out of 10 people either agreed or strongly agreed, and almost half strongly agreed, no, we don't do that here. Hospital number 2, same community. They compete for the same nurses and staff, the same patients, the same donors. Hospital number 2, 7 out of 10 people do not agree with that statement. Which hospital has higher patient satisfaction? And you know the answer, it's 1. Which one has greater employee loyalty? 1. Which one has higher nurse turnover? 2. Which one has healthier financials? 1. Which one has had the most bad press? 2. See, by that one question, by knowing how people treat each other and whether your culture tolerates those what should be intolerable attitudes and behaviors, you can predict almost everything else. And one reason so many patient satisfaction or customer satisfaction programs fail is they're not addressing these root causes. And that gets me to this idea of invisible architecture. 8 years ago, I was invited to do a Nurses Day event at Midland Memorial Hospital in West Texas. Bob Dent at the time was the chief nursing officer. He's since become a good friend and a co-author. He's now at Emory Healthcare in Atlanta. And after our day, I spent another day just making rounds. And he took me on a tour of this brand new building that was still under construction. We still had hard hats on. And here's what Bob said. Our patient satisfaction scores are so bad that we have been cited by our accrediting body. But we're not worried, he said, because look at this beautiful new hospital coming up now. That's going to take care of everything. So what do you think happened when they opened this beautiful, and it is beautiful, new hospital? Patient satisfaction went down. Why? Because by opening this beautiful new building, they raised patient expectations. Then they moved in the same old culture, the same old attitudes, same old treatment, and the gap between higher expectations and the same old experience got even bigger. So Bob called me up and he said, I guess we need to work on our invisible architecture. Now think of this. When you build a new building, think of the planning that goes into it. You want to build a new hospital, you start with something like this, an architectural rendering. Wouldn't that be beautiful? And they go through multiple iterations of it. And then you start to lay everything out. This is how it will look. And then you go to a computer, actually you have an interior designer, lay it all out on a computer so you know what everything's going to look like. But then you got to make sure it's going to work. So you build a room in cardboard and you move stuff around to make sure that everything fits. And then you put it into a detailed design drawing, but you're not done yet. Then it becomes contract documents that go to the construction company that could be 6 feet high. And then we move in the invisible architecture without any thought. We put more planning into what color is our carpeting and wallpaper going to be than what is the invisible architecture that's going to go inside that building. And that's the challenge I'm giving you. Because when it comes to the patient experience, when it comes to the employee experience, when it comes to your community's experience, invisible architecture is more important than the visible architecture of bricks and mortar. We call it the blueprint behind the blueprint. And in a very real sense, this is the soul of your organization, the way bricks and mortar are the body of the organization. Now, when you build a building, you build it in 3 stages. You put down a foundation, you build up a superstructure, you come in and finish it off with carpeting and wallpaper. And we use that as a metaphor for the invisible architecture, where the foundation is core values. Core values should define who you are, what you stand for, what you won't stand for. Done right, it should be the most important document in your entire organization. Let me give you an example of how important this can be. I was at an airport a while back, right before COVID. I had a fairly long layover. I went to Hudson Bookseller to get a book and an energy bar. They had several kinds of energy bar. They had Power Bar and they had Cliff Bar. I had time, so I went back to the waiting area and I Googled core values, Power Bar, core values, Cliff Bar. I got to Power Bar, and that's what it was. We are a Power Bar, and that's exactly what they talked about. It was all about us. We are great. We are wonderful. You're going to love us. We do such good work. I got to Cliff Bar and they said, we don't have values, we have aspirations. We want to have a different kind of a bottom line, not just about our business. We want to sustain our people and our communities and our planet. And you click on any one of those boxes and it takes you to a whole list of all the things that they do. I bought a Cliff Bar. I continue to buy Cliff Bars. I like Power Bars better, but I like what Cliff Bar stands for. And if somebody's got a choice between one hospital and another, they're going to go with the one that really reflects that knows who it is, what it stands for, and what it won't stand for. And most hospitals have a generic boilerplate statement of values. It's something like this. I bet 1 out of 4 hospitals in America have some variation of eye care. And there's a real problem with this sort of generic boilerplate. Number one, it doesn't differentiate you from any other hospital. Of course you have integrity. Of course you expect compassion and excellence. So does Mercy and Methodist and Baptist. For that matter, so does the grocery store and the gas station down the road. How does it distinguish you? Second, that's a pretty low bar, isn't it? I mean, if you have to talk about integrity, I worry. You have to talk about compassion, I worry. That's a low bar. Those are, for me as a patient, those are minimal expectations. I want to see values that try to help you go above that low bar. And third, you're not going to inspire people with boilerplate. Integrity, compassion, accountability. I bet you anything. Well, I know this for a fact. Most hospitals, most employees don't know what those values are. Why? Because they're not inspired by them. So we worked with 2 critical access hospitals in Wyoming on either end of the state. And over a multi-year period, one of the things we did, we called it the Great Wyoming Values and Culture Challenge. And each hospital, as part of this challenge, came up with a meaningful statement of values. We had Memorial Hospital of Converse County on the eastern end of the state, which is sort of very blue collar, mining, industrial. And on the western end of the state, we had Star Valley Medical Center in Afton, which is near Jackson Hole and the mountains and a lot of outdoorsy sort of stuff. Here's what they came up with in Douglas at Memorial Hospital of Converse County. And it very much reflects their personality. They're very sort of linear, very sort of left brain, but notice that they call it invisible architecture. They have their values, integrity. Underneath each value, it describes what they mean by that. And then off to the right, these are the specific behaviors that we expect from you. Star Valley Medical Center came up with something very different. The words are, there's no, if you do it right, there's no cookie cutter, there's no boilerplate. You do something that is authentic for you. And each statement of values reflected the personality of the organization, the nature of the community, the kind of people who enjoyed working there, and they're very authentic, and they're both still in place. So these are the values of Marshall Browning Hospital from your website. And I submit to you that number one, they're not even really values. Patient community-centered care, that's not a value. That's something you do. Service, quality and safety, financial viability. Those are very minimal standards. Those are things you learn about in Business School 101, but they don't do anything. If you're interviewing me for a job, reading this isn't going to tell me why I should work with you. And there's I'm going to challenge you in a minute on this, but it's important to understand what we mean by values. There's a values, behaviors, outcomes continuum. And let me give you an example. The example would be trust. You know, Covey and others have written about how important trust is. Some organizations have trust as a value. I think that I agree with that. I think trust is really critically important, but trust is not a value, is it? It's an outcome. You earn trust. And how do you earn trust? Honesty, reliability, humility. I don't trust people who don't tell me the truth. I don't trust people who tell me they're going to do something and then don't do it. I don't trust people who are arrogant and look down their nose at everybody else, because they eventually break the rules. They eventually hurt people. And what is the value that inspires honesty and reliability and humility? It's integrity. And so I would challenge you to think about your statement of values. And that doesn't mean that it's inappropriate to have an outcome in a statement of values. You know, excellence is an outcome. It doesn't mean that behaviors are inappropriate. Compassion is a behavior. But what are the values that inspire the behaviors that create the outcomes? And so here's the first of the questions that I'm going to give you as sort of homework. What values have you seen in the past couple of years during the COVID crisis that inspire you? I bet you have seen courage. I bet you've read stories about courage. I bet you've read about resilience. I bet you've seen teamwork and fellowship. I bet you've seen some things that you don't want to see in your organization. And if you were redoing a statement of values today, how would those things, maybe courage or resilience or self-care? I mean, we've seen the importance of taking care of yourself. Should those things be elevated to the status of core value? Would this be a good time for you to be thinking about and refining a meaningful statement of values, and then giving it a nice graphic treatment like they did at Star Valley or Memorial Hospital of Converse County? Now, on that foundation of core values, the superstructure is culture. Peter Drucker, the man who invented modern management, is famous for having said, culture eats strategy for lunch. And it's true. Of course, it's best when the two work together. I define culture very simply as this: it's the personality, it's the character of your organization. And think about the companies that you admire. I'll bet you anything it's not because of their cheap prices, their good service. I'll bet you anything it's because of their culture. You know, the survey after survey shows that Costco is more admired than Walmart, Southwest Airlines more than United, Zappos more than, they're in the same business. They sell the same products to the same customers. They recruit the same kind of people, but Costco and Southwest and Zappos have far greater employee loyalty. They're able to command better prices because of their culture. You know, Costco and Walmart are in the same business, but the experience of working or shopping couldn't be any more different. Business Week ran a story on Costco a while back, And they wrote about ecstatic employees. Have you ever heard Walmart accused of having ecstatic employees? And if you shop at Costco, you know you need to pay to get in the door. You got to buy a membership to get in the door. People shop at Walmart because they don't have to dress up like they do for the dollar store. Now, Jim Collins is one of the leading authorities on culture and leadership. And in his books, he says, you got to start by having the right people on the bus. I agree with a lot of what Jim Collins says, but I don't think he's right on this. Number one, you can't just choose who you have on the bus. If you have 200 or so employees, you can't just come in tomorrow and say, you, and you off. You know, Joyce writes a letter to God. Thank you for the baby brother, but what I prayed for was a puppy. You know, you're going to get the baby brother tomorrow. You can't just throw the wrong people off the bus. Peter writes, please send Dennis Clark to a different camp this year. You know what? Until somebody has the courage to confront Dennis Clark, he's going to show up again tomorrow. What you can do is you can change the bus. Make it the kind of bus that people are proud to be a part of. Make it the kind of bus that people talk to their friends and colleagues about. Make it the kind of bus that when somebody graduates from nursing school or PT school, they say, hey, I've heard about Marshall Browning Hospital and what a great place it is to work. You can change the bus, and then you'll be astonished at some of the people that you may have thought don't belong on the bus, at how they really turn around. One way to do that is to create a statement of cultural philosophy that is not just descriptive, but also aspirational. We worked with Children's Hospital New Orleans and helped them create a meaningful statement of values. But we didn't stop there. We created a statement of cultural philosophy, and it's 4 pages long. And this is one of 11 things that they think are really important for their culture, and that is play. We play so our children can play. This is not a nice thing to do at Shinola. This is an expectation of your work, that you're going to smile, you're going to laugh, because it's so important for our children to smile and laugh. And I will never forget my first day at that hospital. They were sending Jeremiah, this 18-month-old boy, home to his brand new adopted parents. He had been in this hospital his entire 18-month life. He had serious mental and physical developmental challenges and always would. They had in New Orleans, they call it a second line. The guy in the white t-shirt there, he's playing a trumpet, and they follow, and they're all waving their towels around, and they escorted him from the 5th floor down the elevator all the way through the hospital to the front door where mom and dad are waiting. Mom and dad are in tears. They'll never forget this day. They may forget the name of the doctor and the nurse. They will never forget how they brought Jeremiah to them. And in New Orleans, they like to say, laissez la bon temps rouler. My French is not good, but let the good times roll. That's the chief nursing officer with his senior team demonstrating how to play so that our children can play. And that's something you see a lot in that organization. So here's a question for you. Question number 2. What is your cultural philosophy? How do you define what expectations that creates for people's attitudes at work and the behaviors? And by the way, I'm going to send you all these slides, and you all have this book, which goes into much greater detail. So I'm not going to spend a lot of time on this, but I want to share with you one tool in this book. It's on page 162. It's the culture mapping schematic. Here's how it works. This is a great thing to do as a leadership group. It's a great thing to do individually in departments. The assumption at the beginning is you want to have a culture of ownership in your department, in your hospital, on your patient care unit. So you start with why. What are the benefits? And these are the essential characteristics of a culture of ownership in the book that everybody has, the Florence prescription: loyalty, resilience, safety, quality. Those are the ultimate outcomes. The what is, what are the essential characteristics? And they're described in Florence. Things like commitment and passion, pride, stewardship. And at the outside, well, how do we do that? And these are the practical things. Well, we could encourage self-empowerment. We could cultivate higher levels of trust. There are, if my math is right, there are 693 potential pathways through this wheel. None of them are wrong. What this does, it forces you to focus on one key area. So let's say, for example, you really want to work on better relationships. I mean, resilience and all those other things are important, but you're going to focus on relationships. So what are you going to work on? Fellowship, belonging, those things are important, but you're going to work on pride. If everybody had greater pride in our organization and in their professions, relationships would be better. And then how are we going to do that? And again, anything in that outer circle will work. You say, well, if we could get people to think about their personal values and how they relate to our organizational values, they'd be more proud and relationships would improve. And again, this is a great exercise. There's no right answer, no wrong answer. But it will focus you on what is one thing that we can do to build a more positive culture. Now, back to our construction metaphor, the interior finishes attitude in the workplace. I love this statue by Bobby Carlyle. She's a Colorado sculptor, and it's called Self-Made Man. And he's got a hammer in one hand and a chisel in the other, and he's carving himself out of this block of stone. And what a great metaphor for life, isn't it? And the hammer and the chisel are the work that you choose to do and the attitude with which you choose to do that work. That's how you carve the person you become. I was in Vietnam 4 or 5 years ago and I took this picture. And I think of all those kids, this is a elementary school classroom in a small village in Vietnam. I can tell you who the future leader is going to be. And I bet you can too. It's that kid right in the middle, whose attitude is, he's so excited to be there, and everybody else is just kind of standing there. I took this picture at the Atlanta airport. Southwest Airlines advertisement. All airline employees have attitudes. Ours just have the good kind. They are using their reputation for positive attitudes to create a competitive advantage over Delta, which is based in Atlanta, and United and all the others. I sometimes ask, what would happen if United Airlines ran that exact same ad? And people laugh. I once had somebody say, somebody would paint a mustache on the flight attendant. And I said, well, who would do that? And the person said, another United employee. I said, really? He said, I know that for a fact. I am a United employee. These two people have the same job, don't they? What's different? Attitude. Who do you think is happier? Dances with mops or mopes with mop? Who would you rather work with? Someone who dances or someone who mopes around with their mop? Who would you rather live with? And most important, who would you rather be like yourself? Most important choice we ever make, and it's one we make all day, every day. What's your attitude? Somebody says something to you that you don't like, what's your attitude about it? Something happens, someone asks you to do something, what's your attitude going to be? Far more important than anything else. And there's good news. Science has shown there is no attitude gene. It's a choice that you make, pure and simple. Is it an easy choice? Sometimes not. Back to our paradox, it's more important to have a positive attitude when it's hardest to do. And over time, attitude in your workplace will be defined by what you say you expect and what you tolerate. And what you tolerate will dominate what you say you expect. You say we expect integrity, but your culture tolerates two people talking about a coworker behind that person's back, and you've lowered your bar about what you really mean by integrity and encouraging disengagement. Back to the emotional vampires and the zombies. You know, Jim Clifton is the CEO of Gallup. They do the Gallup poll. And he wrote a book called The Coming Jobs War. This was pre-COVID. He had no idea how bad it was going to get with staffing shortages. But he said a disengaged employee, especially a disengaged manager, is a quality defect, just like giving a patient the wrong medication. Cy Wakeman, you may have seen her book, No Ego. She's a brilliant speaker, but she does research on drama. She says the average employee spends 2.5 hours a day on drama. And that's pretty consistent with what other surveys, including ours, are finding. That is a CEO in training right there. So I want to share with you, and I hope that you all really take this to heart. Simple promise that if you take it to heart, it will change your life in a positive way. And if enough people take it to heart, it will transform your organization. And it's in the Florence prescription book. It's also a chapter in Building a Culture of Ownership in Healthcare. It's a simple pickle pledge. I will turn every complaint, my head is killing me, into a blessing. Thank God for modern pharmacology. Or a constructive suggestion. The first symptom of dehydration is a headache. I should drink some water, or perhaps I'm having caffeine withdrawal. I should drink some coffee. There's nothing that you can complain about that you cannot find something constructive to do and something to be thankful for. Now, let me be very clear. This does not mean put on a happy face and ignore problems. Quite to the contrary. If you have a headache, instead of just sitting around complaining about it, go to the pharmacy, go see somebody, ask for some time off, take a nap. It doesn't mean to gloss over things. It means don't allow yourself to become a victim. And that's what complaining always is. You're saying, poor me, something I don't like is happening. And here's what happens when you take this to heart. You replace resentment, and that's what complaining always is. I'm resentful about something. That's why I'm whining, with gratitude. You replace learned helplessness. And why would you complain if you thought you could do something about it? You've convinced yourself you can't do anything, so you moan and complain about it. With initiative, well, let's do something about it and not just complain about it. And it replaces the inner directed poor me of complaining with outer directed being compassionate for others. And what would happen if you declare your workspace a pickle-free zone? I don't want to hear your whining and complaining. Take it to HR. They get paid to hear it. So go talk to a counselor. And where we're seeing people do that, it's having an incredibly positive impact on how they treat each other and on what they see when they look in the mirror. And this is a hospital in Texas, a hospital in Georgia. Please stop complaining around here. People are bringing in pickle jars and they're fining each other. Every time you're caught whining or complaining, you're asked to put a quarter in the pickle jar. One day a guy came in, he said, I know it's going to be a shitty day. Here's a buck. I'm paying in advance. And he ended up having a pretty good day because instead of the old passive aggressive thing, Bob's having a bad day, they laughed about it. They talked about it. And we're seeing the most amazing pickle jar decorations. This is Loma Linda in California, where I was last week. I don't remember where this was. This is one of my favorites. Isn't that what people who are always complaining sort of feel like? And isn't that what you want to do? It's just stick a pacifier in their mouth and say, oh, poor baby. And this is my all-time favorite. Be brave enough to start a conversation that matters. Whining and complaining has never solved the problem, has it? It takes courage to actually stop complaining and actually do something. Talking about somebody else behind their back will never help that person be a better person. It takes courage to actually go talk to that person. But that's the only way things finally change. And we're challenging people to take this pickle challenge for charity, and by turning complaints into contributions, raising money for an important cause. This is the Pickle Squad at Methodist Hospital in San Antonio. It's a big academic medical center. They raised $7,000 for the HCA Hope Fund. They're taking all that complaining and helping people who in another state whose homes have been torn apart in a hurricane, or people who are struggling with cancer or burn injuries. And it's having a positive impact on their culture. We've had 43 hospitals that we know of. Every now and then I hear of someone else who've done it. Raise almost $100,000. Imagine if we could get every hospital in America to take this to heart and raise money for the mental health of caregivers. And I'm keynoting the Association of California Nurse Leaders next year in February. And we are going to challenge every hospital in the state of California to take this to heart with a goal of raising $1 million for caregiver mental health in a state where people are really struggling. So here's my question for you. How do you, as leaders of your organization, model the attitudes and the behaviors that you say you expect of your people to build the culture you want and to live the values that you say are important to you. And this is something that's in the Florence prescription book that everybody has. I've sent Larry a PDF of this or a JPEG of this. I would encourage you to print it out and give it to everybody. Because the three things that really characterize a culture of ownership: people are emotionally positive, they're self-empowered, and they're fully engaged. And then mount them where people can see them. And hold each other to that standard. I thought you made a commitment. You were going to be emotionally positive. Why are you whining and complaining? Why are you not doing something about it? So let me shift gears and tell you what 95 of your colleagues told me about their perceptions of your culture. Now, we did the survey. It's called the VCI 17. It's a validated survey. We did it separately for all employees and managers. And I'm going to share it just for the all employees. Frankly, there were not a whole lot of differences. I would have pointed them out if there were. We also did surveys for the medical staff and the board. I'm not going to share that, but I will tell you that those responses were very, very positive. And again, the executive summary, what you're telling me, your colleagues, is that your perception of your culture is it's pretty good, but it's not great. And here's why that's so important. Again, back to Gallup organization, they're the world's authorities on polling. And there's a real tendency to take strongly agree and lump them together. And what Gallup is telling us is that those are qualitatively very different responses. Strongly, someone who agrees, they're what Frederick Reichheld, he's the authority on employee and customer loyalty. They're what he calls a butterfly. Oh, they like the job. They're happy enough with it. But you know what? If they get a better opportunity somewhere else, they're out of there. Pay raise somewhere else. Those are the fours. The fives are what he calls barnacles. They're with you. And you do that through culture. I have never heard of a pilot from Southwest Airlines quitting Southwest to go to work at United. I think it's never happened. But there are a lot of United pilots who would do anything to go to work for Southwest. Not for the pay raise, but because of the culture that they have. They're the fives at Southwest, at Costco. So the first series of questions had to do with personal commitment. And I asked people this question. I am personally determined to give my best effort at work every day. And here's how this works. The green bar is strongly agree. The blue bar is agree. And then the percentages, the 98%, that is blue plus green. And the 48%, that's just the green. So of your colleagues who responded to this, and it was about a 50% response rate, which is good, about half of them strongly agree with this statement, and half of them agree, and nobody disagreed with it. I'm personally committed to practicing the values of this organization. Pretty much the same pattern, a little bit lower on the green bar. Now, I would ask you, if we were in person, are you happy with this? And I hope you would say, well, that's pretty good, but wouldn't we want to have, when you're talking about I'm personally committed, wouldn't we want to have 100% green bar on that one? And then I would ask you, well, if you're at 98% agree or strongly agree, are you perhaps wearing rose-colored glasses? Because if you're wearing rose-colored glasses, you're going to be at 98% of you are going to be saying, yeah, I live the values. Yeah, I'm committed. It's all those other people who aren't. So let's take a look at what other people said about their colleagues. Our teammates know the values of this organization. So the green bar gets a lot smaller. And there's a little bit of disagreement with that. This is good. I mean, we've seen huge gaps from 98%, yeah, I'm great, and everybody else is terrible. This is pretty good, but there's still a gap here. Our teammates are committed to assuring those values are reflected in their work. This is pretty good. For one thing, there's not a big knowing, doing gap. Our people know the values and they practice them. There's a little bit of a fall off, but it's not a lot. And we have seen a lot. So this is pretty good. dealing with change. And I've never been in a 18 or 24-month period in my healthcare career with more change than during COVID and everything else going on. Our teammates are advocates for progress. About half agreed or strongly agreed, not many. A lot of people unsure. I'm not, I mean, we didn't ask, why are you unsure? Is it because you just don't know or you've never been tested? Very few people strongly disagree. Our people don't just complain about problems, they work on solutions. There's a little bit of a drop from they advocate for to they actually do something, but it's not a big drop. And our people effectively manage change. And again, a little bit of a drop, but 4 out of 10 either agree or strongly agree that you do pretty well at that. Notice though that the disagree has gotten bigger when it comes to our people effectively managing change. Cultural expectations. I feel encouraged by my leadership team. About half either agreed or strongly agreed with that. Notice that about a quarter disagreed or strongly disagreed, which raises the question, you know, what do you need to do differently? This is not something, you don't need an MBA to encourage people. This is not you don't need spreadsheets. What can you do that people get the message that you are encouraging them through these challenging times? And the question that when I remember I said a tale of two hospitals. Our culture does not tolerate bullying, toxic negativity, or disrespectful behavior. That's pretty good, but it's not great. You know, 2 out of 10 strongly agree with that statement. A little over half agree or, and notice, see how small the unsure is. You've got about a quarter of your staff not agreeing with that statement. Our managers do a good job of dealing with those behaviors. This is an area where these two curves are often almost identical, but notice that people are less impressed with how management is dealing with it than they are with the actual problem itself. So what can you do to convince your people that you take those behaviors seriously and that you're dealing with them effectively? And then I asked people to estimate what % of all paid hours get wasted on toxic emotional negativity. We did a weighted average. 37 people, and by the way, the weighted average was the same for management. I think it was maybe 14%, but 37 people said it's less than 10%. 19 people said it's more than 20%. Now, 19 of your colleagues think that the average employee comes in on Friday morning, goes to work, and stops working on Thursday at 5, and comes in Friday, and all day Friday engages in disrespect and bullying and spreading rumors and getting paid for it. That's what more than 20% means. And so I can ask you, what are you paying people for these inappropriate, counterproductive behaviors? It's an easy calculation. Your annual wage, salary, and benefit budget is $11 million. I'm not telling you this. Your colleagues have told me 13% of that is wasted. So you are spending $1.4 million a year paying people to bitch, moan, whine, complain, and gossip. How many FTEs is that? If somebody donated $1.4 million to your organization and said, this is a restricted donation, all you can do is hire people to do work, what could you do with all of that? And I'm telling you, the people are there. And it's not just the dollar cost, it's the indirect impact of those behaviors on everything else: quality, safety, productivity, the patient experience, everything else. Your community respect for your organization is affected by how much of that time is going down that drain. And then I had a few questions that are new about the impact of COVID-19. How's your own stress level? This is better than the national average, quite better. Some people are really feeling overwhelmed, but most people feel like they have it reasonably under control. And have you seen our organizations reflected in how we've handled this pandemic? And again, your responses are really quite good here. So in this, we have some good news and some bad news. Here's the bad news. There were 13 questions on a 5-point scale from strongly agree to strongly disagree. Your colleagues had more than 1,000 opportunities to strongly agree with a positive statement about your hospital, and that only happened 13% of the time. We've seen worse, but we've seen better, and you want to be better, I know. The good news, they only strongly disagreed 3% of the time. What that tells me is you have, as your colleagues perceive it, you have a real opportunity for improvement, and you're not swimming against a strong current going the other way. So question, would you put those results on a billboard? Would you want to put this on the outskirts of your town, where you get really great care with a pretty good attitude? Or do you want to wait until you can improve that to a really great attitude? And a few other questions. Is it really great care if it's delivered with just a pretty good attitude? Will it support your reputation as being a great place to work and help you recruit and retain talent and provide a great patient experience? Are you okay with those results, or do you want to make it better? And if you do, whose job is that? Let me wrap up with a couple of thoughts. One on what are the essential things you have to do? What are the key success factors to sustain a positive culture change? I'll send Larry, we have a white paper that outlines 20 of them, but I want to share with you the top few. And number one is enthusiastic engagement of leaders at every level. I don't just mean going along with it. I mean really embracing it, being enthusiastic, modeling the attitudes and the behaviors yourself. Number two is how the people on this call, how your leadership colleagues are going to communicate this to everybody else. If you go back and say, here we go, another program of the month, you're going to be dead in the water. And 2 or 3 months from now, it's another program of the month. If you go back and say, you know, these are really challenging times, we need to do something different, and we're going to work on our culture. So please read the Florence prescription book. Let's talk about it. Let's talk about how we apply those things here. You're going to have a completely different experience, but you got to walk the talk yourselves. So how you model it, if people see you changing your behavior, if they see you putting a pickle pledge door hanger, pickle free zone door hanger on your office, and I've sent a handful of them to Larry, and we can send more if you need them. Those are the things that are going to change. People will watch your behavior a lot more carefully than they'll listen to your words. Expect resistance, but don't give into it. You're going to have people say, this is silly, we don't have time for this. And here's the thing, the people who are the most loudmouth objections are the people who most need it. And they're the ones who could most benefit if you stick with it. And finally, 2 more things. Don't make this the first step, but make a long-term ongoing commitment to keep investing in your culture and your people. This is not a once and done. And finally, opting out is not an option, especially for managers. Otherwise, you got a culture of optionality. I don't want to be engaged. I just want to come in, do my job, and go home. If you're a manager and that's your attitude, you're going to infect all the people around you. So a couple of concluding thoughts on leadership. Here's, you read a lot about the difference between leadership and management. They're both important, but here's my take. Management is a job description. It's a set of tasks that you do. You can learn about it in business school. Leadership is a life decision. You don't need to have a management title to be a leader. When somebody comes onto a Habitat for Humanity project, they're all volunteers, and somebody becomes the leader. They don't need a job title to do that. Management is what you do. Leadership is who you are. That's why example is so very important. Management seeks compliance. Management's about accountability. Leadership seeks commitment, holding themselves to higher standards. Management is transactional. It's running the business, getting the bills paid, getting the work done. And those things are important, but leadership is transformational. It's about changing people, about helping people be more clear about their own values, their own goals, helping people be better people. And in today's VUCA world, VUCA is a military acronym for volatile, uncertain, complex, ambiguous. Not in my lifetime have we seen more VUCA than we have in the last couple of years. Your hospital, every organization, we need leadership in every corner, not just in the corner office. Joel Barker writes about leadership, and his definition of a leader is this: it's someone who takes you to a place you didn't know you wanted to go. I really like that definition because it implies two things. One is creating a vision of that place. Wow, I didn't know we wanted to go there. But second, and more important, it's motivating, inspiring people to make the effort, to make the journey, to get back up when they fall down, to be resilient, to not be victims when bad things happen. I like that definition. My definition is a bit more personal. A leader is someone who helps you achieve goals you did not know you could achieve by helping you become the person that you didn't believe you could be, by helping you be the lion in your mirror. And to me, that is the real leadership challenge. You achieve that goal and the culture will take care of itself. The culture takes care of itself, and patient experience and all those other things will take care of themselves.